There are three things that are concerning about fibroids that will cause them to lead to a possible cesarean section. And those things include the size of the fibroids, the location of the fibroids, and the number of fibroids a woman has. If a fibroid is located low in the cervix, it can completely block the cervical opening. Well, if the cervical opening is blocked and the fibroid is relatively large in size, the more a woman begins to contract and dilate if she's allowed to labor naturally, the higher the chance of uncontrolled bleeding and even the need for an emergency cesarean section. Hello, moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. I am on a mission to make moms and dads all over the world informed contributors in their own maternity journey. If this is your first time here, you are most welcome. Make sure you hit the subscribe button and then turn on your notification bell, because that is how you are made aware of every time a new video is uploaded. Also, be sure to check out some of the other topics that are covered, as it may address one of your questions or your needs. In today's video, I will be discussing some reasons why a pregnant mom may need a cesarean section. But before I jump into some of these factors, make sure that you remember that this information is for educational and informative purposes only. By no means should you use this information to diagnose yourself or self-treat. So make sure you are working with a healthcare provider that is well informed in your personal needs, so that a plan of care can be established to address what you are most concerned about. It is very important to state that there is no right or wrong way to give birth to a baby. The most important outcome for any woman is that she is healthy and that her baby is healthy, and that there are as little complications as possible following the delivery. Now, before I jump into today's video, I want to put it out there that this is divided into three parts. The first part is going to deal with maternal factors. The second part is going to deal with fetal factors. And then the third part will deal with things that a woman or her baby just cannot control. So without further ado, let us jump right in. Reason number one why a woman would have a cesarean birth is personal choice. Many women are choosing not to go the vaginal route and just schedule a cesarean birth, even for their first babies. And that's for a lot of reasons. Many women are very afraid that their labor could be prolonged or out of their control. So they are choosing to schedule their cesarean section because C-sections are well controlled births. Now keep in mind that if you choose to schedule the birth of your first baby to be via cesarean section, that your doctor will work with you to get your delivery date as close to your due date as possible. This is because a due date is arbitrary, meaning it is not fixated. A lot of times a woman could be plus or minus 2 weeks based on when she conceived her baby. And if a C-section is scheduled too soon, then a baby can be delivered as a late preterm baby. So getting you as close to your due date as possible is just ensuring that your child is as mature and as ready to thrive in the outside world as possible. Also keep in mind that if you choose a scheduled C-section for your first baby or any baby's birth, then other births following that birth may also have to be delivered via cesarean section. So that's just something that women should consider when they make that decision. Now, this leads to the second reason for a cesarean birth, and that is a prior C-section. When a woman delivers by a cesarean section, keep in mind that the uterus is a muscle. So every time it is cut into, it is compromised and its integrity is not as secure as it was before the incision was made into the uterus. So if you have delivered by a cesarean section before, the chances that you will need to deliver by a C-section the next time you have a baby is higher than if you would have had a vaginal birth. Now, it is possible for a woman to have something known as a virginal birth after cesarean, or VBAC for short. If a VBAC is an option for you, make sure you talk with your provider about the risks and the benefits that accompany it. And just keep in mind that the longer you go between births, the more favorable it is for you to have a VBAC. Reason number three why a woman may need a cesarean delivery is active disease or infection. If a woman is dealing with conditions such as human immunodeficiency virus, HIV, or herpes, she may have active lesions. And if a baby is coming through the birth canal and comes in contact with some of these secretions, it may lead to very adverse outcomes in that baby. So if your doctor discovers that you are dealing with an active breakout, or if your HIV is poorly controlled, you may need to deliver via cesarean section. Other conditions such as high blood pressure, gestational diabetes, heart disease, and even kidney disease may cause a woman to be a candidate for a cesarean section. And that is because these diseases tend to complicate the way the body works, and pregnancy is already tasking on a woman's body. So if she has to push beyond a lot of blood pressure issues or gestational diabetes causing issues in the baby, which will be discussed in the next part, may cause a woman to have a very difficult or even need an emergency cesarean section. So it's best to just go ahead and plan one to begin with. Now, the next reason why a woman may need a scheduled cesarean delivery is if she and her doctor reach the conclusion that the shape of her pelvis is not compatible with a safe vaginal delivery. A lot of times the baby is a normal size, a normal weight, and the baby is even positioned head down, but the shape of a woman's pelvis is not compatible with delivery, or her pelvis is too narrow. If she's allowed to labor, she may have many complications, and it may even lead to an emergency C-section after she's labored for a long while. So it's best for a mom with an incompatible pelvis to go ahead and discuss with her provider if a scheduled C-section may be favorable for her. Now, last but certainly not least is the presence of fibroids in a woman's uterus. There are 3 things that are concerning about fibroids that will cause them to lead to a possible cesarean section. And those things include the size of the fibroids, the location of the fibroids, and the number of fibroids a woman has. If a fibroid is located low in the cervix, it can completely block the cervical opening. Well, if the cervical opening is blocked and the fibroid is relatively large in size, the more a woman begins to contract and dilate if she's allowed to labor naturally, the higher the chance of uncontrolled bleeding and even the need for an emergency cesarean section. So in that situation, it's better for her to schedule a C-section to help her control the rate of bleeding. And with doctors looking directly into the uterus, they're able to note where the fibroid is and avoid some very negative outcomes in the birth of her baby. Also, if a woman has a lot of fibroids, then it kind of presents an obstacle course, which can not only compromise the quality of the pregnancy a woman can have, it can also lead to unfavorable outcomes if she chooses to deliver naturally. Now, as previously mentioned in the beginning of this video, make sure you use this information just to educate yourself. When it comes time to make plans on how you will deliver your baby, make sure you work closely with a healthcare provider who knows all about you, because no 2 women are exactly alike. If you know somebody who can benefit from the content of this video, make sure to share it with them. And don't forget to hit the subscribe button and turn on your notification bell, because that is how you are made aware of every time a new video is uploaded. Make sure you come along with me as we build this community of informed learners who are active contributors in their own healthcare. I wish you a happy, safe, and healthy maternity journey. And until the next time, be blessed.